Welcome to today's webinar. County Health Rankings and Roadmaps is a program of the University of Wisconsin Population Health Institute. This webinar is brought to you thanks to the contributions of colleagues and partners in Wisconsin and across the nation, with support from the Robert Wood Johnson Foundation. It is produced in collaboration with Healthy Places by Design, an organization that advances community-led action and proven strategies to ensure health and well-being for all. The University of Wisconsin-Madison occupies ancestral Ho-Chunk land, a place their nation has called Dejo since time immemorial. UW-Madison respects the inherent sovereignty of the Ho-Chunk Nation, along with the 11 other First Nations of Wisconsin. This webinar will be recorded. All speakers' views are their own. Guest bios and slides from today's webinar are available on our resource page. We will share a link to the resource page when the webinar begins. Stay up to date on all things CHR&R. Find us on Facebook, Twitter, and LinkedIn. And if you haven't already, sign up for our newsletter by scanning this QR code with your phone's camera. It's the best way to find out about upcoming webinars, our podcast, and our latest tools and resources. Your facilitators today include our host, Erica Burrows-Girardi, with support from CHR&R Communication Specialist, Colleen Wick, and the Collaborative Learning Director from Healthy Places by Design, Joanne Lee. We invite you to continue the conversation immediately after the webinar in our discussion group. Joanne Lee will be our lead facilitator. And watch for a chat from Colleen for details on how to join the group after the webinar.
Welcome to Public Health Alternatives to Policing and Incarceration. My name is Erica Burrows-Girardi. Today's topic may not seem like it fits into the scope of public health, but it absolutely does. And it's a topic that we've heard you, our audience, say you want to learn more about. CHR&R's webinars reflect the values we hold as part of the University of Wisconsin Population Health Institute. Values of collaboration, integrity, excellence, innovation, inclusion, and courage. These are the values that we aim to model during the webinar, and we hope that you will too. With that, I'd like to introduce you to the team that will aid in your learning experience. Let's start with Joanne Lee with Healthy Places by Design. Hi, Joanne.
Hi, Erica, and hello to everybody in the audience. So glad to be here for a really thought-provoking webinar today. And so, folks in the audience, we invite you to join the conversation and engage with us during the webinar. And there's two ways that you can engage with us. One is you can ask panelists questions. Anytime a question comes to your mind, you can enter them in the Q&A box, and we'll answer as many questions during the live webinar as possible. But make sure if you have questions to put them in the Q&A box and not the chat box. And I will introduce you now to Colleen Wick, who will tell you how you can use the chat box to engage. Colleen?
Thanks, Joanne. Hi, everyone. As Joanne said, I will meet you guys in the chat. And as you could see, the chat is already really active. So please use the chat to share knowledge or respond to any questions we ask you during the webinar. Also, please make sure to help us and join us in making the chat space welcoming by adhering to a few guidelines. So use the chat to share successes, lessons learned, relevant resources, and links. So just please engage in a respectful dialogue. As you could see, the chat conversations are very engaging. So if this is too distracting for you, you could just simply close the chat window in Zoom. Also, please know that views expressed by speakers and participants are their own. They do not represent CHR&R or Healthy Places by Design. And again, if you have questions for the panelists, please use the Q&A box. And now I will pass it on to our technologist, Erin.
Thanks, Colleen. Hi, everyone. I'm Erin Schulten. I will be helping with your technology today. Please send us a message in the Q&A box if you're having any trouble seeing the slides or hearing the presentation on your end, and we'll do what we can to help. Now I have over 99 messages to catch up on chat. I'll go ahead and turn it over to Erica for today's great webinar.
Thank you so much, Erin. Thanks to everyone on our production team. They do such a wonderful job. We all deserve to feel safe in our homes and in our communities. In fact, the chronic stress associated with feeling unsafe can accelerate aging and harm health. Feeling unsafe can cause anxiety, depression, and stress, and is linked to higher rates of preterm births and low birth weight babies. Fear can keep people indoors, away from our neighbors, away from exercise and opportunities to get healthy food. That's why it's important for people who violate laws to, quite frankly, be held accountable to achieve justice. At the same time, we are asking these questions. Are all people who violate laws being held to the same standard of accountability? Are stop and frisk and other aggressive policing strategies being applied in the same manner in every neighborhood? And do we hold police accountable when there are differences in how people are being treated? How about our mental and physical health? Are our physical and mental health impacted by police using excessive force? Even just witnessing that excessive force. And we're asking these questions about incarceration policies and practices. Are people who fulfill their sentences offered support and pathways to healing so that they're prepared to reenter society successfully and reduce recidivism? Are prisons focused on accountability and healing, or is the focus punishment? Many prisons now are privatized. You've probably heard that. So, how can a prison center people in healing when incarcerated people are their primary commodity? I could go on, but let me be clear. Achieving justice does not mean we have to sacrifice safety. Having both is possible if we find public health solutions. To build communities where everyone feels safe, we need to prevent crime in the first place by addressing the root causes, not just reacting to it after it happens. According to Vera Action, poverty, mental illness, substance use, and homelessness are at the root of much of the crime communities experience. So, we are fortunate today to be joined by two community organizers and strategists who are passionate about creating a just world by addressing root causes and advocating for a justice system that seeks accountability and restoration. Join me in welcoming Christine Mitchell, the Health Instead of Punishment Program Director at Human Impact Partners, and Mark Rice, the Wisconsin Transformational Justice Campaign Coordinator at Wisdom, a faith based social justice organization in Wisconsin. Welcome to you both.
Thanks, Erica. Thanks for having us.
And thank you, Mark. We'll have a discussion group right after the webinar to unpack what you're going to hear today. Please plan to continue the discussion with us. During the video intro, you heard about our discussion groups that follow the webinar. They are facilitated by Joanne Lee, always engaging, giving you the opportunity to share and learn from others. So Colleen will be chatting out the information at the end of the webinar so you can link to that discussion group. And then look for this webinar's resource guide, including links from CHRNR, links our guests have shared with you, and relevant links shared by your peers in the discussion group. We'll be sure to send that resource guide out to you before the end of the week. Now, before we get started, I just want to bring this up again because you've heard us talk a lot about structural determinants of health in this space. So, as a reminder, structural determinants are written and unwritten rules, including policies and practices, traditions, narratives, that determine how our society works. These determinants can influence our health opportunities. As we hear from Christine and Mark, listen for how these structural determinants, policies, resources, even narratives determine policing and incarceration. And with that, I want to invite Christine back. Christine, let's just get right into it. How would you describe the intersection between racism, policing, and excessive criminal penalties?
Yeah, thanks, Erica. I want to start by saying that I'm going to be running pretty quickly through some of the existing research on this topic during our time today. But as I do that, I want folks to be mindful of the fact that each number that I share represents a real human life. Also, please remember that people with lived experiences of these systems don't need to know these numbers to know that the systems are deeply harmful, but people in power often do in order to be compelled to change policy. And while I don't have lived experience with incarceration, nor do most of my social identities represent those who are disproportionately targeted by these systems, many of you in the room may have such experience, either through yourself or a loved one. So I invite you to share your expertise in the chat and discussion group today as you feel comfortable. So to get to your question, Erica, we really need to start with the history of policing incarceration. So US policing evolved from efforts to control Black people via slave patrols, and that's the flyer that you see on this slide here. Efforts to control the immigrant working class and efforts to control worker unions. And Black codes, which were passed in many states immediately after the Civil War and included vagrancy laws, meant that Black people were subject to arrest if they broke a labor contract. So the history of policing is deeply entrenched in racism. The history and development of mass incarceration as we know it today, where the US incarcerates 1.9 billion people, more than any other country in the world, we need to be looking at that too. And this happened in a couple different ways. So first, by policies that increase prison admissions. So for example, things like stop and frisk, which allow police officers to stop, interrogate, and search people on the sole basis of having reasonable suspicion. The use of the criminal legal system to criminalize mental health needs, homelessness, substance use, and addiction. And then Nixon's war on drugs in 1971 really made the incarceration rates skyrocket. And there's a Nixon aide who came out saying that the Nixon White House, this is a quote from him, the Nixon White House had two enemies, the anti-war left and Black people. We knew we couldn't make it illegal to be either against the war or Black, but by getting the public to associate the hippies with marijuana and Blacks with heroin, and then criminalizing both heavily, we could disrupt those communities. We could arrest their leaders, raid their homes, break up their meetings, and vilify them night after night on the evening news. Did we know we were lying about the drugs? Of course we did. So that again shows you really how entrenched these policies are in racism and in social control. So that's the first. The second are policies that increase the length of sentences. So for example, the 1994 crime bill, also known as the Violent Crime Control and Law Enforcement Act, that provided more funding for 100,000 new police officers, allocated $9.7 billion for prisons, provided grants to build and expand prisons, instituted the 3 strikes law, which meant that a person who's convicted of an offense and who has 1 or 2 other previous convictions has to serve a mandatory life sentence in prison. We also see things like mandatory minimum sentencing, so that anyone who's convicted of certain crime that has a mandatory minimum attached to it gets at least that sentence. And then finally, truth in sentencing laws is an example of this. So that eliminates opportunities for any sort of early release, requiring people to serve a certain percentage of their prison term physically behind bars.
Yeah,
So where does this leave us?
Go ahead, Christine. Oh, I was just going to say this is staggering. I don't know about for those of us in the audience, but this is reeling. I mean, hearing this information. But please, where does this leave us?
Absolutely. Yeah, it's reeling. And I do want to make sure that folks, take the time and space that you need for yourself as I kind of run through all of this, because it is a lot. So where does this leave us in terms of the way that racism shows up in policing and incarceration today? So you can see this graph where it shows up in police violence. So Black Americans are 3.23 times more likely, Indigenous people 5 times more likely, and Latina people 1.5 times more likely than white Americans to be killed by police. It also shows up in incarceration. So Black Americans are 6 times more likely, Indigenous people are 4 times more likely, and Latina people are 2 times more likely than white Americans to be incarcerated. And then finally, with policies like stop and frisk, here's an example from New York, where we saw that Black folks were 8 times more likely, Indigenous people 6 times more likely, and Latina people 4 times more likely than white people to be stopped and frisked by police.
And this is something that we in public health should care about. Why does this matter to public health?
Yeah, this is a great question. So I'll say a couple things here. One is that the American Public Health Association has named that these things matter to public health. So there was a policy statement in 2018 that passed about law enforcement violence. And then a policy statement in 2021 passed about carceral systems, both naming the harms of policing and incarceration and the need to invest in communities rather than in policing and punishment. So that's kind of an overarching, it matters to public health, and the American Public Health Association has policy statements that agree with that. Let's break that down a little bit more. So we can look at the impact of policing on health, right? So aside from the obvious health harm of being killed by police, there's also a high burden of non-fatal injuries by police. So CDC data shows that since 2015, more than 400,000 people have been treated in emergency rooms because of a violent interaction with police or security guards. And then even in the absence of any physical violence, several studies have found that stops are associated with symptoms of anxiety, depression, and post-traumatic stress disorder. And then for folks who are undocumented, including immigration and customs enforcement in the category of policing, the fear of deportation can lead undocumented folks to not seek needed medical care. And then that can create stress, which can lead to all sorts of symptoms due to that heightened anxiety. When we look at incarceration's impact on health, a stunning fact is that each year in prison takes 2 years off of an individual's life expectancy. We also know that unhealthy conditions in jails and prison result in higher rates of things like HIV, asthma, cancer, arthritis, high blood pressure, chronic disease, other infectious diseases. We saw this during COVID. And then there's a high level of medical neglect happening in jails and prisons where people aren't receiving the medical care or the prescriptions that they need. And so that results often in illness being finally treated at late stages when it's too late. And then finally, extending beyond the walls of prisons and jails, it's not just within those settings. There's survey data that shows that people who are under community supervision through probation and parole have mortality rates 2 to 3 times higher than the general population, more likely to report poor health, chronic conditions, kidney disease. And then there are all the laws and policies that create unhealthy conditions for people after they come out of prison. So for example, in 2020, an estimated 5.2 million Americans were forbidden to vote because of felony disenfranchisement. And so that restricts their access to participate in any political decisions that affect their health and that of their families and communities. There's also policies that make it really hard for someone who's formerly incarcerated to get housing. So this statistic that you see on the slide, that after someone experiences incarceration of any form, their odds of experiencing houselessness increase from 1 in 200 for the general population to 1 in 11 for people who are recently released.
Yeah. And that's one of the reasons why we see homelessness being at a core issue or root cause, especially if you're thinking about recidivism. You know, earlier we were talking a little bit about over policing and how that can impact individuals, just even witnessing something like this. But what about the community as a whole? Like, what are the social and economic impacts of over policing in a neighborhood?
Yeah, yeah, I want to start with just a language note there. You mentioned over-policing. And Human Impact Partners, we intentionally don't use the phrasing of over-policing because we know that all policing can be harmful to health, not just over-policing. Similarly, with mass incarceration, we tend not to or try not to use that phrase because we know that all incarceration is harmful to health, not just mass incarceration. So to look at some of the community impacts, the economic impacts are huge. We're pouring billions and billions of dollars into police and into prisons. Since over the last 40 years, expenditures in policing and prisons has grown by 310%. And that disproportionate investment comes at the expense of resourcing the health and social support systems that people need for positive health outcomes. There's also all kinds of money that is being poured into the cost of fatal and non-fatal injuries by law enforcement. In 2010, that cost was $1.8 billion. The social impacts, neighborhood level stop and frisk and use of force was linked with elevated levels of psychological distress among folks who lived in those neighborhoods. Among youth, exposure to violence from school-based law enforcement officers is linked to the denial of educational and social growth, which we know are both key determinants of health. And then the health impacts more directly on the community. There's an emerging body of research that points to spillover effects to non-incarcerated community members who live in heavily incarcerated communities. And so some of those effects include county level mortality, preterm birth, depression, and anxiety. And I want to name here too that an important strategy to reducing police violence is to reduce the opportunities for community members to have any police contact. So therefore, while policing reforms like community policing might improve the community's perception of police, it can actually increase police violence because there's a higher police presence in a neighborhood.
So, all of us have grown up seeing police in our communities at some point, and um, you were saying that any form of policing, can be harmful to our health. So, what are the alternatives to policing that actually center public health and move us upstream to prevention strategies?
Yeah, thank you so much. So I think the bottom line here is that we ask police to do too much. We're asking them to do things that they are not trained for, and that they shouldn't really be trained for. So we saw this in the recent police killing of Sonia Massey, whose photo you see on the slide in Illinois. Um, if trained mental health professionals or social workers or nurses had responded to her call instead of the police, Sonia Massey might still be alive today. But in order to do that, in order for that to be able to happen, we need to invest in non-police solutions rather than in reforms like more training for police. So you'll see also on the slides that non-police crisis response teams, and here are 3 examples of them. There's Mental Health First, which is based in Oakland and Sacramento, Relationships Evolving Possibilities, which is based in Minnesota, and HEART, which is based in Cambridge, Massachusetts. Really investing in those things is a great public health solution to addressing police violence and the harms of incarceration. Looking further upstream even, we need to be investing in the social determinants of health. So things like housing and transportation and healthcare and substance use treatment, childcare, with the knowledge that when we invest in those things, instead of in policing and punishment, it can actually prevent harm from occurring in the first place.
And according to what you said, there are actually millions of dollars that could be reinvested into the social determinants of health. Yeah. So, our audience is primarily in the public health space. What can public health professionals do to help us move in the right direction?
Yeah. Yeah, so this is a resource that Human Impact Partners came out with a few years ago called Health Departments Taking Action on Incarceration. We also have a similar resource about health departments taking action on police violence. We'll make sure that those get sent out to you all after this. But some of the things we recommend in this resource for folks in health departments and people in public health in general are to develop and deepen relationships with community organizers in your community. Those folks are often already building power directly with people who are impacted by incarceration and policing and are often leading local campaigns that you can get involved in. Another is to use your public health platform and the power that that carries with it to validate, amplify, and meet the needs of those who are directly impacted by incarceration and policing. For those of you who are researchers, we really need to continue to strengthen the evidence base on how incarceration and policing harms individual, family, and community health in your jurisdiction. We need to get clear on public health's kind of legal and institutional authority, and then build the consensus that might be needed within your health department if you're working in health department to understand the public health crisis of incarceration and policing, to advance solutions that will be most strategic and exercise the authority that you do have.
Yeah, thank you. There's lots of ways that we in public health can be a part of this. Now, I'm going to go back to what you were saying earlier about, the policing, that there is, that causes harm. So if we don't have policing, how do we hold people accountable? I mean, how do you do that if there are no consequences? Just asking what other people might be asking.
Totally, totally. And not the first time I've been asked this question by any stretch of the imagination. Um, so one thing I want to be really, really clear about is that the types of change that I'm talking about don't mean no consequences. Like that's actually antithetical to what I'm talking about. Rather, I'm encouraging us to understand that punishment doesn't mean justice, and punishment doesn't mean accountability. The changes I'm talking about mean that the consequences for someone who does harm will support the transformation of the person who did harm and the transformation of the systems that allowed such harm to happen in the first place. And in fact, our current consequences, punishment for harm via the criminal legal system, really don't create space for any accountability. So you can see that in this chart that's on this slide. I'll just quickly read through some of this, the difference between accountability and punishment. So accountability is something you choose to do versus punishment is imposed by others with power over you. Accountability recognizes and requires your power, including your power to enact repair, and punishment aims to diminish or contain your power, which it presumes can only be harmful. Accountability is fundamentally active, so it requires you to actively address the suffering that you caused. And punishment's largely passive, just requires you to address suffering by suffering more yourself. Accountability deepens relationship and connection, punishment severs it. And accountability can really foster healing and restoration, and punishment really fosters shame and isolation.
So you can see how accountability can lead to less recidivism because people are actually being restored and healed and addressing what really was at the core of what brought them there in the first place.
Exactly.
Yeah,
Yeah.
yeah. So who needs to be a part of like a partnership that's committed to reimagining a criminal justice system that centers what you're talking about, that centers health, that centers healing, that centers restoration instead of punishment? How do we make this happen?
Yeah. So I haven't used this word yet, but it's on this slide, and everything that I've described here today is consistent with an abolitionist politic. So we understand abolition at Human Impact Partners as a movement to build up community-based systems and structures that support health and safety and that ensure people have what they need to thrive. So we think of abolition as both a goal of a world that we want to create and a strategy of building that world where community safety and accountability don't rely on policing or punishment. Programs which and systems and structures which I want to also be clear, our communities have been building for generations without ever necessarily having this word attached to it. So really listening to our communities is so hugely important because they have the solutions. So as the slide reads, this is a quote from abolitionist scholar and educator Ruth Wilson Gilmore. She says, abolition requires that we change one thing, everything. And so when we think about who needs to be part of a partnership to bring about this world, we need to be building broad-based coalitions with housing, with healthcare, transportation, disability justice, racial justice, elder care, faith leaders, social workers, artists, public health, and currently and formerly incarcerated people. So I really want to emphasize that absolutely essential need to build partnerships with the people who are most disproportionately targeted by policing and with people who are both currently and formerly incarcerated. And there are plenty of organizations across the country that are fostering this relationship building that I'm sure you can find in your own communities. And then within
And
public health,
oh, God.
let me just say quickly, within public health, since I know a lot of folks here are in public health, each sector in public health also has a part to play. So at HIP, our capacity building team works with public health departments to build their muscle on health equity and racial justice. Our policy and organizing team works with public health students, faculty, non-governmental organizations to build up power to create this world. We do intentional community-driven research where we're working with community organizers and providing them another tool in their toolkit to point to these things that they're working on as public health issues. And I just, want to close, I guess, by saying that everyone really has a part to play. And I'm just grateful to be here with you all as you explore what part you might play in this work.
Oh, thank you so much, Christine. I've learned so much, and I appreciate you opening up this conversation, getting us started, and we'll circle back to you for Q&A in just a moment. And you all heard Christine say that recommend that the public health partner with organizations that are centered in community, that are people centered, community power building organizations. Well, Wisdom is one of those such organizations. So I want to welcome Mark back because, Mark, what I want to explore with you is what does this work look like that Christine is talking about? I know at Wisdom, you all call it transformational justice. So how do you define transformational justice?
Yes, at the center of transformational justice, it's about divesting from the carceral system and investing in communities to invest in the sorts of services and programs that will actually create stronger, safer, and healthier communities. We have four components of our transformational justice campaign in Wisconsin. The first part is reducing the prison population. That's always been a goal. This is a campaign that's been going on since 2011 now. And so we aim to cut the state's prison population in half. And you can see here the incarceration rate of Wisconsin locks up a higher percentage of people than almost any other democratic country on earth. And so, and key part of that is what we call our justice reinvestment framework. And so that is number one, we're demanding no new prisons. There's a lot of discussion in Wisconsin about building a new prison. We are opposed to that. And then we're pushing a decarceration agenda that includes expanding treatment alternatives to incarceration on the front end, giving people who are currently incarcerated a fair chance to get early release from prison. And then on the back end, we're focused on ending what people call revocation without new convictions. So people are being sent back for technical violations, allegations with no new convictions. And so just by those three policy changes, there's more to that, but that's just the introduction to it. We can cut the prison population in half, and then we can close several prisons. In Wisconsin, there's several prisons that are really, the conditions of confinement are horrific. Green Bay Correctional Institution, Waupun Correctional Institution, also Milwaukee Secure Detention Facility, MSDF in Milwaukee. And then Wisconsin would be able to redirect resources to build healthier communities. We could invest in jobs, healthcare, housing, treatment services, educational programs. So that's the vision of.
Yeah. And then here's another one of the goals.
Yeah, so all of our issue campaigns center racial and economic justice. There's a racial justice component to every single issue campaign. In Wisconsin, it's really crucial right now because by some measures, Wisconsin detains Black people at a higher rate than any other state. By some measures, Wisconsin detains Indigenous people at a higher rate than any other state. You see the numbers here from the Prison Policy Initiative, and there's been extensive research in Wisconsin really showing the huge racial injustice within the system. And so that is really a crucial component for us in Wisconsin.
And how about narratives? How do they fit into this?
Definitely. So I saw Stephen Mangual was on the call, who's a legendary organizer, leader from New York City. And
Thank you.
I want to definitely recommend reading The Language Letter by Eddie Ellis, which really breaks this down. Possibly Steve, hopefully you can learn more from Stephen, but this is also, so definitely we're talking about challenging, dehumanizing, and offensive language that is often used to label people who've been through the system. So we often hear these really harmful terms used by members of the media, by politicians, by others, sometimes people who don't even understand the harm that they're causing. But some of the examples of that are violent predator, offender, felon, inmate, convict. And so instead, we urge people to use people-centered language. So we can replace those dehumanizing terms with language like person convicted of a crime, formerly incarcerated people, person who was convicted of a felony, person who was on parole, that sort of language, but definitely centering the humanity, centering people, like, and there's also a larger component about how reimagining how we create safer communities that I mentioned earlier. So instead of investing, we've been far too reliant on investment in prisons, police, and courts as responses to a lot of problems, but instead, of course, we want to invest up front in communities and those programs I mentioned, like healthcare, housing, jobs, treatment services. So that's another huge component that we focus on, is that challenging the dominant narrative around, creating public safety.
Yeah. Yeah. And then the last major goal that you all have is around that restoration piece. Share a little bit about that.
Yeah, so in Wisconsin, our biggest campaign has been Unlock the Vote, led by Expo, Ex-Incarcerated People Organizing. I'm a founding member of Expo also, and other organizations have been involved and working in coalition with Expo. Wisdom has been a part of that and support. And so many people, after people get out of prison in Wisconsin, they still cannot vote if they are under supervision for a felony conviction. And Wisconsin is an outlier in terms of the rates at which people are put under supervision after they get out of prison. So we're really pushing to restore voting rights. People should never lose the right to vote, in my opinion, but the campaign with Expo is focused specifically on ensuring that once people are back in the community, they can have those rights restored, they're able to vote. And then there's many other rights that get taken away, like the right to hold public office for state and local elected positions in Wisconsin. If you have a felony conviction, you're not able to run for a public office, that sort of thing. Also, there's a huge number of permanent punishments, that things such as occupational licensing restrictions, which prohibit people with certain convictions from being able to get placed in certain jobs. So there's that permanent employment discrimination. It can be housing discrimination based on some types of convictions. There's particular punishments that follow people long after, even after a person's off of supervision, that where people are still being discriminated against. Is what Michelle Alexander described as a system of the new Jim Crow, which some of you might remember that book, which is this system of permanent exclusion, which we're working to take down some of those, all of those permanent punishments, and ensuring that people's rights are restored.
Yeah, thank you for all the work that you're working on. And it's important to note that, I know you're Wisconsin focused and Wisconsin centered, but we see this happening across the country in other states too. So it's not just Wisconsin that's really struggling. It's a lot of, it's the country as a whole. Christine was showing those statistics earlier about how we incarcerate so many people in the United States compared to other countries. Um, I want to. I specifically asked if you'd be willing to do this, and you said you would. But would you mind sharing your personal journey with the justice system?
Definitely. So the state of Wisconsin forced me to spend a few years in the state prison system back in 99 and 2000. I went in as a teenager and got out when I was 21 years old. And it was a really eye-opening experience for me. I really witnessed the deep racial injustice within the system. I met a lot of young Black and brown and indigenous men coming into the system who had sentences of 30, 40 years. I was in a maximum security prison at first, and so I only had a sentence of 2.5 years, and then was able to get back out in the community. And many of those young men had convictions less serious than the conviction that I had. So I saw that, like I said, the deep racial injustice, which was really a formative experience for me. And then it's shaped a lot of the work that I still am doing today. But for myself, I was a lot of the issues that I had were related to trauma that I experienced when I was younger, that we often hear that, it's a common experience among many people who've been incarcerated, family members who experience addiction issues, related issues to that. And then was diagnosed with a serious mental illness, a disabling mental condition later on when I was in prison for the first time that I didn't really realize that I had. And so became familiar with that and started to, learn more about that, educate myself about issues related to mental illness and also economic challenges as well, just, struggling with stable employment and that sort of thing. So it's still ongoing, but yeah, and then was able to get back into the community, eventually was able to get a bachelor's degree from Upper Iowa University in Madison. Also went to the University of Wisconsin-Madison for a while as an undergrad, and then eventually went on and got a master's, actually 2 master's degrees from the University of Wisconsin-Milwaukee, one in nonprofit management and leadership, one in urban studies. So then was able to get into the organizing work that I do today. So definitely experienced in, going through many county jail systems. I mentioned the state of Wisconsin prison system. And then, one of the positive experiences I would say is that I had the opportunity to start taking college courses when I was in prison, which I feel is a real useful program if we're going to continue to incarcerate people at the rate we do. So that's what we're fighting against. But, the educational programs, educational opportunities for higher education, especially, then I was able to continue that and get all those degrees eventually, which I felt really opened up a lot of doors to me, that opened up a lot of opportunities that most likely would not have been opened up otherwise without that education and network that I built through, taking all those programs. But I got connected with Wisdom back in around 2013. I was in Milwaukee. I was a student at the University of Wisconsin-Milwaukee at the time. And one of my professors, Professor Aaron Schutz at the University of Wisconsin-Milwaukee, teaches community organizing courses. And I was interested about organizing efforts to end mass incarceration in Wisconsin. He let me know about what used to be the 11 by 15 campaign, which is now transformational justice. And so I started getting involved, met with David Liners, the state director of Wisdom. He invited me to get involved with MICA, Milwaukee Inner City Congregations Ally for Hope in Milwaukee. We had a local task force for a statewide organization. We're also a national organization. Gamaliel Network is a national national organizing network based in Chicago. We have affiliates throughout the entire country. And also, you mentioned the national component. I'm also member of Just Us, Coordinating Council with Just Leadership USA, as former staff, and gone through some of the training programs with Just Leadership USA as well, and also involved with Human Impact Partners. So definitely come with that national perspective as well. And
So
yeah,
go ahead. I'm sorry, Mark.
yeah,
So I was gonna, and I apologize for cutting you off, but I did want to ask you this question, but before we run out of time, what do the transformational justice campaigns do? Like, because for us, we want to know how can we help? How can we get into it? It's good to know that you're part of a network that has a national focus, so we'll make sure folks know about that. But what do the campaigns do, and how can public health help?
definitely. The first part I would mention is that we invest in the leadership and development of directly impacted people. So it's really important to center the voices and the strategies of directly impacted people that Christine mentioned as well. So that's a critical component of Wisdom, Just Leadership USA, and most of the organizations I'm involved with really believe in that component. So there's a lot of leadership development opportunities, and then strategically placing people in positions where they can utilize power, utilize the skills that they've developed from these programs. Like the Just Leadership USA Leading with Conviction program is one example that Stephen and I both been through. And then there's definitely a lot of direct engagement with policymakers, a lot of one-on-one meetings. Right now, voter engagement is really crucial in Wisconsin. We just had a situation where we flipped the Supreme Court and it resulted in fair maps actually being passed through. So previously, Wisconsin was one of the most gerrymandered states in the United States, which created a lot of difficulties for us in moving forward a legislative agenda. So there's going to be a lot of new faces in the state legislature. So we're doing candidate forums, candidate engagement throughout the state. Particularly, we had primary today, actually. So we did a lot of strategic campaign, the candidate forums and primaries, and then we'll do that ongoing through the general elections, and then holding people accountable after that. And then there's lobby days. We have Madison Action Day every 2 years, right after the state budget is introduced, where we aim to get around 1,000 people at the state capitol, meet with every single state legislator and let them know about our legislative priorities and really have a lot of directly impacted people again, sharing testimonies, and definitely a lot of public meetings. There's the narrative shifting components, so doing a lot of media work. You see one of my letters to the editor in the Capital Times here, so definitely doing a lot of op-eds, doing these sorts of the appearances that I'm making right now, but also getting out on TV shows, on radio shows, and in the community, doing speaking engagements within the community, that sort of thing, elevating the personal stories, as I mentioned, and then partnering with public health, like human impact partners has been really crucial for some of the work that we had. So during COVID is one example where, so we partnered with human impact partners back in 2016 to do a health impact assessment around excessive revocations in Wisconsin. So we're talking about people being sent back for minor infractions who are under supervision, like missing an appointment with the parole officer, unauthorized computer or cell phone use, or crossing a county line without agent authorization, those sorts of things. But people actually being sent back to jail and prison in Wisconsin for that. And so during the beginning of COVID, Governor Evers and Wisconsin Department of Corrections Secretary Kevin Carr actually took recommendations straight from that report and reduced the prison population and jail population in Wisconsin by almost 2,000 people by moving forward a few of the recommendations that we had around not sending people back for these
It was simply like crossing the county line. That's
Yes,
something like,
yes.
yeah.
The issues related to mental health, like in my situation where I've been sent back, I've experienced that myself, where issues related to mental illness, but no new conviction, no new crime was committed. But unfortunately, it was sent back for several, almost 6 months in one case. And so people are going back and average a year and a half, 18 months for
Yeah.
revocation or new conviction. So that, and it cut the population in half at Milwaukee Secure Detention Facility. So we saw how fast that they can actually start to reduce the population, but now it's really a matter of ensuring that those policies continue on, the lessons learned from COVID. But unfortunately, that's not happening in a lot of places, and that's really the key going forward is, continue those partnerships and continue to put pressure on to make sure that some of those common sense policies stay permanent.
And I want to remind folks that you were saying is the public health data is so important. It's our superpower. Christine talked about the importance of data. Real quickly, Mark, I want to ask you, why do stories matter? Tell us that about that, and then we'll get into your Q&A.
Definitely. So here's one of my colleagues, Shirley Moffett, who we partnered with Mass Story Lab around, due to my experience and the experience of so many other people who have been in Milwaukee Secure Detention Facility, it was a prison in Milwaukee Secure Detention Facility, or MSDF, that was built entirely to hold people for rule violations. So people aren't being sent there for new convictions, but it's also one of the most inhumane prisons in the United States. And one of my colleagues, James Wilborn, died there in 2015 due to heat exhaustion. And there's some who committed suicide. And hear Shirley's story where she talks about becoming depressed and suicidal due to the conditions of confinement that are so horrific in that place, where people are locked down over 20 hours a day. The heat is really extreme in the summer, no air conditioning. At the time I was there, people were being forced to sleep on the floor because of so much overcrowding and no in-person visits. And the ventilation is really poor. So it's a really stressful and traumatic experience for many people. And I think getting those stories out was the start of really helping us with base building and get a lot of people behind. We launched that campaign and people thought it was a joke at first, but then within 1 year after we launched, we had support from all the leading Democratic candidates for governor. They said MSDF needs to be closed as soon as possible. So it went from being a joke to being something that was taken really seriously by leading candidates for governor in the state of Wisconsin. And then they actually started to address it and push forward some of those policies that we recommended during COVID. And so and it all started primarily with centering the voices of directly impacted people and centering the strategies and policies that we were recommending. So that's really key.
Yeah, yeah. And I know for those of us in our audience about how you want to, there's ways that you can learn more about the work that Mark does at Wisdom. And so here's his contact information. And if you have any questions from Mark and Christine, be sure to get them into the box because we're getting ready to head over to Joanne in just 1 second. Um, but um, I want to thank you, Mark, for sharing that powerful and inspiring story. I was sharing with Christine and Mark that coincidentally, I had a similar situation that happened in my family literally today with someone who has been struggling with mental health and has had numerous encounters with the criminal justice system because of that mental illness. What Works for Health is an online tool that helps you find policies and programs and systems changes that affect the factors that we know make communities healthier places. The factors we were talking about today, housing and transportation, et cetera. Over 4,000 strategies are in What Works for Health, and we have three that we want to draw your attention to that's related to today's webinar: restorative justice in the criminal justice system, focusing on deterrent strategies and drug courts. So we'll make sure that those are in your resource guide. And so right now I'm going to ask Joanne to come to the mic, let us know what questions have popped up.
There are too many to mention, Erica, and I'm going to have to apologize. We're also much, much shorter on time because there's so much great information to share. So just remember, folks, that please bring your questions, especially the ones that might be more involved, to the discussion group, and we'll try to get to as many as possible. But I'm going to start with Mark real quick because I have a fast question, I think easy, quick to answer. People, their ears perked up. You referenced a book, and so they wanted to just, if you can mention the title and the author again and maybe put it in the chat, that'd be great. Many people are asking about that.
Yeah, Eddie Ellis, The Language Letter.
Mm-hmm.
And
Eddie Ellis. All right. Somebody tried to Google it and got a children's book. So we just wanted to double check. All
yeah,
right. And so Christine, I'm going to ask you to come back because I think this one would be great for both of you to address because there were multiple questions with one common theme, and we sort of focused today on alternatives to policing. And folks are just really curious about your opinions, both of your opinions about what can be done, though, about current relationships with police or training. Um, and so maybe we can just sort of have you both comment about how that might be part of the solution, work with law enforcement, and if there are some questions and we have time, we can go from there.
Should I go first?
Yes, please.
Okay.
And then Mark will have you comment.
Yes. So I have a few thoughts about this. I think one is when we talk about abolition, that doesn't mean that police and prisons and jails and detention centers go away tomorrow. We know and are like very pragmatic about the fact that we need to be building up the systems that will replace them in order to facilitate that. There's a site called 1 Million Experiments that I recommend folks check out, which has a whole lot of examples from all across the country of folks who are building up these systems in their communities. In terms of relationships with police or with departments of correction, I'll speak for us at Human Impact Partners. We don't work with police or departments of correction because our accountability is to the folks who are directly harmed by those systems. This can be really difficult, especially in research where they're often our only source of data, and in government where they're often seen as partners at decision-making tables within the government. And I'll share also that the End Police Violence Collective, who are the folks who co-authored the American Public Health Association policy statement, which I recommend you all read because it really tackles a lot of those policing reforms, including training. That group wrote in 2020 what they called the Pledge of Non-Collaboration, which was signed by hundreds of public health folks from across the country, which outlined what it could look like in research, policy, and practice to say, I'm not going to work with these systems. I'm instead going to work with the communities to see what they really want and need.
Great.
repeat
Yeah,
that.
so Mark, I think folks are just wondering if police reform or partnerships with law enforcement and the carceral system can be part of the solution to the goals that you and your group is trying to attain.
Yeah, definitely. Unfortunately, so definitely abolition, I agree, should be the long-term goal, but we know that's not going to happen overnight. And so right now in Wisconsin, particularly with the Department of Corrections, we've definitely built out a relationship with the Department of Corrections Secretary, the former, and the person we just changed. There was a transition, and so it can be frustrating because there's a lot of resistance, of course, to what we're doing, and there's a lot of people who are really dedicated to maintaining the status quo. And as a long-term solution, definitely would like to totally abolish, at least me personally, I would like to totally replace the Department of Corrections with and take all their budget and put it into other resources that more, be more helpful. But in the meantime, I feel like in order to actually push forward some of the policy agenda that we need to, it's really a crucial component that we have to, in some situations, build those relationships with people who are in power, because things can be really worse if we don't, like we say at Just Leadership USA, if you're not at the table, then you're on the menu. So we really, believe in that. And, at all different levels, whether you're working for at the local level on policing or the state level with overhauling Department of Corrections and that policy system. But there's definitely some progress that can be made in terms of, improving conditions of confinement, expanding educational programs within the system. So there's definitely concrete results. When we look at people being harmed immediately, I feel like there's got to be immediate harm reduction as well, while we're working to build that long-term, goal of abolition, completely overhauling the system. It's a long-term, it's a process that's going to take many years to get some of these bigger changes that we're working to produce. But in the meantime, definitely feel that we need to be at those tables and to be pushing it, to get as much as we can right now to do that immediate harm reduction work for people who are currently being harmed and are in these prisons right now where, so many people are being harmed, people are dying, there's, suicides in these prisons. And so
Yeah.
that has to be addressed with the deaths, the extreme heat right now in the South, those sorts of things. We have to focus on that immediate part as well.
Thank you. All right. And so, Christine, we have a few minutes left, but I know there's also been some questions about accountability. So, wanted to give you a chance to touch on that.
Yeah, totally. Yeah, I think I'm seeing things, pop up in the chat and in the Q&A too, that I want to talk about what accountability means to folks who have survived violence and survivors of harm. And so if you look at the APHA policy statement from 2021, the one about carceral systems, there's a whole section in there about how this fits into meeting the needs and desires of survivors of harm. And in that, we found a study from 2016. There's a nationally representative survey that found that an overwhelming majority of people who have experienced interpersonal harm, including survivors of violence, preferred accountability measures facilitated outside of the carceral system. Things such as rehabilitation, mental health treatment, voluntary drug use disorder treatment, community service. And in that statement, you can also read a lot of what survivors of violence and harm are calling for, often having to go through the carceral system and through the courts and through the police can actually enact more harm on those survivors. So I wanted to address that. And then I think the other part about accountability is that we don't have well-resourced what those systems could look like in our society today. And part of that is because of how much police and prisons are being resourced. So we can talk more about that in the discussion group, but I wanted to name that.
Yeah, thank you. Very helpful. So, Erica has joined us back, and I know we're short of time, so I'll hand it back to you. Thanks.
Thank you so much. Like everyone said, just so much interaction going on in the chat. I'm gonna ask Colleen to chat out our survey link. And Colleen, if you don't have it, I do, because I'm not sure if I remembered to send it to you. So I do have it if you don't have it. But please click on that survey and give us your thoughts. We definitely depend on hearing from you about what's important to you. It's one of the reasons why this particular webinar was scheduled today, is because of feedback we hear from you. So thank you so much for doing that. Let me tell you about next month because you all heard Mark talk about storytelling. We was just getting into how important storytelling is. Well, we're going to continue that discussion next month because Dr. Nora Moss will be here from Healthy Democracy, Healthy People, and she's going to explain how storytelling can be used to motivate action, particularly around voter participation. You heard the folks talking about the election, heard Mark talk about how important voting is. So we're going to get into that next month. By the way, September 17th, when Mara is going to join us, is going to be voter registration, National Voter Registration Day. So you don't want to miss this webinar. Um, Join us in the discussion group. Colleen, if you'll just go ahead and chat that out. We would love to continue this discussion with Christine and Mark there. So please join us. And hey, folks, you guys, please stay connected with us. We have presence on County Health Rankings at Roadmaps, our newsletter. We are on X, Facebook, and LinkedIn. Thank you for everything that you do to build equity in your communities. And I will see you